in local health departments. We have others in health right clinics, and there are multiple across state local initiatives that we support. We're also working to develop some guidelines for them, best practices, because we want to be evidence-based. And they have had a lot of good things to have said from the community themselves. So they have had a lot of local support, actually. One of the things we try to encourage is to marry these clinics with a comprehensive program where people can not only go there and get those needles and be screened for those deadly diseases, but also then get into treatment and counseling. And we're also encouraging the use of a helpline. That's 844-HELP, number 4, WV. So
that's 844-HELP,
number 4, WV.
Number 4, WV. Okay, yeah, we'll certainly promote that.
So
okay.
That helpline is something that's available 24/7, around the clock. So because we recognize that it's not just 8 to 4 when people think that they might need help. Somebody could be at 2 a.m. in the morning and just realize that, hey, I need to get myself cleaned up and get into something, someplace, and they're looking for help at that point. At that point, that person has decided, and that decision may not stay forever. That I'm done with the way this is going. I need to change my life. And at that point, all they need to do is call this number up. A lot of the folks that run this line are themselves been through former addicts and through the challenges. They understand. They will be very helpful in identifying resources within communities. They will follow up if need to. They will connect people with the available resources across the state. And that's something to get people to help when they want it and when they need it. And as a call line, that's something unique that West Virginia has done. And I know that other states have also asked us for that. And the idea here is not to be judgmental when people call, but to be able to provide them the assistance that they need, on their own terms, and to get them the help.
That's very good. I've read that in many places there are waiting lists for treatment, and there are inadequate supplies of, correct my pronunciation of these things, naltrexone, methadone, and buprenorphine.
Yeah.
Is this true in West Virginia, or?
Well, that was certainly the reason that the call line was started. Because think about it this way: there could be a place that could have a waiting list, and there could be other places that could have a bed available. And one of the things that we needed was a repository of information that would be able to connect people and have an estimate of what bed is available where, and what treatment option is available where. So one of the things that we do is through this call line, we're able to keep the data very close and understand what challenges in terms of naltrexone, buprenorphine clinics, harm reduction clinics, naloxone. What are those challenges? Are we identifying those? So people, as they call this call line, we find out where the deficiencies are, and then we develop programs or help develop programs to correct those deficiencies. So it's a very sort of organized system to find those. There's always going to be areas where there may not be adequate facilities or treatment options available, but that's the job is rather than anecdotally approach it in a data evidence-based manner and then find solutions to address it. Because there's a lot of people actually in communities that I've seen personally that are working very, very hard in a very compassionate manner to address this problem. The challenge often becomes is linking those different programs to individuals, and that's what this line does. As people can get into some program, that's the ultimate solution. To give you an example, with naloxone, if you remember, initially there was legislation a couple of years ago to allow friends, family, and caregivers to obtain naloxone from their doctors. Then there was legislation to actually make it over the counter, so people can go and get it from their pharmacy and pharmacy interns. So now, as the naloxone has become more widely available in pharmacies, we are also seeing from our Office of EMS an increase in uptake in the community level from EMS of naloxone. Naloxone is an antidote that helps reverse the effects of an overdose from opioids, and it really buys time if you inject it at the proper time in an overdosing, passed out individual, to buy enough time to get them to a hospital or emergency room. So this drug is potentially life-saving, and we've seen the numbers of naloxone used across the state double in the last 2 years, double. So we've had a 100% increase in 2 years through our EMS agencies, which is wonderful because we know that that means saving the lives are being saved out there in the community.
Right.
So those are the kind of initiatives that are evidence-based, data-driven, and we're trying to implement and trying to find, if there is an area where we need to do more, we're very open to listening and learning from it.
Now, most treatment is outpatient rehab, correct?
Yes. So there is outpatient, inpatient, short stay, long stay. The ultimate goal of every one of these, I think, if you ask me, what's the ultimate goal of where we need to get to, the ultimate goal, because I mentioned these people are between 20 and 60 years of age, is to be able to get these people not just rehabilitated, but also retrained for workforce and get back into the workforce. That's how the socioeconomic conditions of our state are going to improve. That's also how we're going to have a true economic impact in our state, is to get these folks ultimately treated, rehabilitated, and workforce retrained so they can go back into, because we still believe, having a good paying job is the ultimate solution to a lot of these problems. And
are there enough professionals to treat current persons who need rehab?
There are certainly is currently not enough professionals,
okay.
and that's a whole different a challenge that we're also dealing with, and we're also working to address, because while we don't know the prevalence of the true disease, we also have challenges with having enough workforce, which again can be an opportunity also to make sure that we do have enough professionals, but also have enough trained medical professionals to address this. So we are, sort of, as a cliche goes, building this plane as we are flying it. At the same time, our job is to make sure that we all of us, as a community, as a state, keep the plane in the air, prevent it from crashing, and then continue to improve it as we move forward.
Are colleges offering degrees in or associate degrees in areas related to this?
Oh, absolutely. There's a number of programs that have been started. Universities, I'll mention that, I work closely with School of Public Health at West Virginia University and other programs across the state, certainly in Marshall, and they are very interested in developing programs, whether it's community health workers, whether it's the psychology programs, clinical behavioral health, residency training for addiction medicine for physicians. So there's a lot of work happening across the state in academic institutions. Academic institutions in our state have certainly taken a very public leadership role in helping address the crisis. So again, I think the wonderful thing about West Virginia is that we have a number of partners that have stood up and are ready to work together, and are good partners trying to do the right thing and get to address this problem. So I think that's about the best thing I can say for our state, that we have partners in terms of community leaders, academia, private businesses, as well as local and state government levels, which are aligned together to address this epidemic.
Okay. Now, common sense would tell us that addiction has sparked an increase in crime. Is this true?
I think you'd probably have to talk to law enforcement about that. Certainly, you can always see issues that come out with it. I think